Hello, the CentraCare Health Urology team would like to welcome you to your online learning module. CentraCare Urology is a leader in urologic services in central Minnesota. We pride ourselves on excellent outcomes and creating the best experience possible for our patients. We perform a variety of state-of-the-art procedures to ensure our patients are receiving the most advanced services possible. Our experienced staff includes a multidisciplinary team of physicians, physician assistants, nurses, and a variety of care and support staff to assist you through every step of your surgical experience.
Hello, my name is Bill, and in this module a variety of topics are covered. You'll be able to select the topics that apply to you. While viewing the module, you may pause the video at any time and replay the information as often as you like. The topics covered include anatomy and general information, information on types of surgery, caring for urine drains using the Foley catheter, caring for surgical drains using the Jackson-Pratt or JP, what to expect when you go home from the hospital, and information on exercises, physical activity, and sexuality following surgery, information on patient support and support groups. But before we begin, we think it's important to understand exactly how your body works. So please watch this brief overview of the basic anatomy of the urology system.
The male urinary system is made up of the kidneys, which produce urine, the ureters, connecting the kidneys to the bladder, where urine is stored, and the urethra, the exit passageway from the bladder. The male genital system begins with the two testes, where sperm are produced. The epididymis is a system of convoluted small tubes leading from each testis and emptying into the vas deferens. After being joined by the duct of the seminal vesicles, the vas becomes the ejaculatory duct, which enters the prostate, where it joins with the urethra to convey the sperm, contained in semen, to the penis. The walnut-sized prostate gland is situated just beneath the bladder and encircles the upper part of the urethra. It secretes alkaline fluid rich in enzymes and prostaglandins. This secretion is important to the survival and performance of the sperm. The seminal vesicles also play an important role in contributing secretions which enhance the sperm's chance of success. During ejaculation, the connection between bladder and urethra is closed, while the prostate, seminal vesicles, urethra, and the penis all undergo rhythmical contraction, moving forward the semen, which is composed of sperm plus secretions from the prostate, seminal vesicles, and minor glands. The aging male is prone to develop enlargement of the prostate.
To understand what is going on in your bladder, a cystoscopy may be done. This is done by inserting a thin instrument called a cystoscope into your urethra. The urethra is the tube that carries urine out of your bladder. The cystoscope travels up your urethra and into your bladder, allowing the doctor to look at the inside of your bladder. Cystoscopy may be done alone or along with another procedure. When only a cystoscopy is done, a numbing medication is used at the insertion site, and the procedure usually takes less than 5 minutes. When a cystoscopy is done with another procedure, sedation or deep anesthesia may be used. The length of time it takes to complete the procedure varies based on what other procedures are being done. Prostate procedures we will review include vaporization, transurethral resection of the prostate, and prostatectomy. When the prostate is enlarged, you may experience urinary symptoms, including frequent and urgent need to urinate, difficulty starting urination, slow or long urination time, urinating at night, the stopping and starting of urine flow while urinating, a feeling that the bladder does not fully empty, and an increase in urinary tract infections. The treatments for prostate enlargement depend on the cause of the enlargement and the severity of the symptoms. A transurethral resection of the prostate is a type of prostate surgery done to relieve moderate to severe urinary symptoms caused by an enlarged prostate. The surgeon inserts a visual and surgical instrument through the tip of your penis and into the urethra. Excess prostate tissue that is blocking urine flow is removed. The procedure is usually done under deep anesthesia and takes about 1 to 2 hours. In some cases, the procedure may be done without hospitalization, but patients may have a hospital stay of 1 to 2 days, depending on the procedure.
An indwelling urinary catheter, commonly called a Foley catheter, is a thin, flexible drainage tube inserted into the body. It enters where you urinate and goes into the bladder. A small balloon is inflated at the tip of the catheter to keep the catheter in place. The catheter will continuously drain urine from your bladder, so you'll not need to use the toilet to pass urine. Following surgery, you may need a Foley catheter in place to help drain urine. When you're not able to adequately drain the urine in your bladder, it can increase pressure at the surgical site and cause complications. Infection rates also increase if you're unable to empty your bladder. In order to reduce your risk for complications and to help the site heal, some patients will require a Foley catheter to be inserted. Depending on the procedure you have, your Foley catheter may be in place up to 10 days after surgery. Later in this module, we'll discuss care of the Foley catheter at home. When you're discharged from the hospital, you'll be given 2 catheter bags. The first catheter bag is called a leg bag and is used during daytime hours. This allows you to be more mobile and discreet. It easily fits under loose-fitting pants and attaches to your leg with securement straps. Leg bags hold a smaller volume and should be emptied every 2 to 3 hours, or if it becomes too full. The second catheter bag is called an overnight bag and is used while sleeping. This allows more rest time between emptying your catheter bag. Overnight bags are a larger drainage bag and should be emptied every 8 to 12 hours. In this section, we'll provide you with step-by-step details on the following items: draining your catheter bag, cleaning your catheter bag, switching from a leg bag to an overnight bag, and switching from an overnight bag to a leg bag. Let's begin with step-by-step instructions on how to drain your catheter bag. Before we get started, you will need a sink with soap to wash your hands, a measuring container, and a toilet to dispose of urine. To drain the leg bag, follow these steps. Wash your hands with soap and water. Remove the cap and open the clamp. Do not touch the drain port with your fingers or allow it to touch the urine measuring container or toilet seat. If you were instructed to measure your urine, drain it into a measuring container so you can record the amount. You should also note the color and consistency of urine. To assist with the color, you may use the Hematuria scale given to you at discharge. If you do not need to measure the urine, simply drain the urine into the toilet. After the urine is drained completely, close the clamp and replace the cap. Wash your hands with soap and water. To drain the overnight bag, follow these steps. Wash your hands with soap and water. Release the tubing from the plastic holder by squeezing the clips. Do not touch the tip. Open the metal slide clamp and let the urine drain into the toilet or measuring container. Do not let the tube touch the toilet or container. Close the metal slide clamp and reinsert the tube into the plastic holder. Wash your hands with soap and water. It's important to clean both your leg bag and overnight bag when they're not in use. This helps to reduce your risk of infection. Before you get started, you'll need the following items to clean your catheter bags: water, white distilled vinegar, A large container with a lid. An example would be a quart glass mason jar. Large syringe. The hospital will provide you with your initial syringe. And alcohol swabs. Using your large container with a lid, mix equal amounts of vinegar and water. 1/2 vinegar, 1/2 water. Do not use yellow vinegar. You will need a total of 1 cup of solution to clean both bags. Using the large syringe, draw up the vinegar solution. Use an alcohol swab to wipe the bag's connection port and remove the cap. Gently push the solution into the bag through the attachment port. Repeat with a second syringe filled with solution. Clean the connection port with an alcohol wipe and recap the port. Swish the solution around and then empty. The technique keeps the bags clean and reduces odor. Do not rinse the bag with water after using the vinegar solution. Let the bags air dry. You may use both types of drainage bags for up to 1 month. After 1 month, you'll need new bags. You can purchase new bags at home health supply stores or ask at your doctor's office.
How often should you clean your overnight catheter bags? A. Once per week. B. Once per day. C. Twice per week. D. Twice per day. The answer is B. Once per day.
To change your catheter from a leg bag to an overnight bag, use the following steps. Wash your hands with soap and water. Drain the leg bag. Clean the connection between the catheter and leg bag with an alcohol wipe. Disconnect the leg bag. Clean its connection port with an alcohol wipe. Replace the cap and set aside. Remove the cap from the end of the overnight bag and clean the end with an alcohol wipe. Connect the overnight bag to your catheter. Clean the leg bag. Decide which side of the bed you'll hang your bag from. Tape or use a securement device to secure the catheter tubing to the thigh nearest the overnight bag. Hang the overnight bag lower than your body at all times. Arrange the tubing so it doesn't kink or loop. To change your catheter from an overnight bag to a leg bag, use the following steps. When you're ready to reconnect the leg bag in the morning, empty the overnight bag, fasten the leg bag with the elastic bands, clean the connection between the catheter and drainage bag with an alcohol wipe. Disconnect the overnight drainage bag, clean its connection port with an alcohol wipe, replace the cap, and set aside. Remove the cap from the end of the leg bag and clean the end with an alcohol wipe. Connect the leg bag to your catheter and make sure there are no kinks in the catheter tubing. Both catheter bags should be used with a securement device. A securement device is a device that is applied to your leg to reduce tension on the bladder and keep the catheter from being unnecessarily pulled on. It's important to ensure the securement device is in the proper location and allows the catheter to drain without obstruction. If a securement device is not available, you may use tape to secure the catheter properly to your leg. The catheter bag should always be positioned below your bladder. This allows for gravity to assist with urine drainage. If you feel like you have a full bladder, you should check to make sure there are no kinks or loops in your catheter tubing. If the catheter is above the bladder or is kinked or looped, it can cause urine to flow back into the bladder. A full bladder can place more pressure on the incision site, increasing your chance of discomfort. In addition, if urine backs up into the bladder, it can increase your risk of infection. Never remove the catheter unless specifically directed by your healthcare provider.
Where should the catheter bag be positioned at all times? A. Above the bladder. B. Even with the bladder. C. Below the bladder. D. Above your heart. The answer is C. Below the bladder.
It's important to keep the area around your catheter clean to prevent irritation and infection. Cleanse the area around the tip of the catheter and rectal area at least twice daily and after bowel movements. This is usually completed in the morning and evening. Clean using a washcloth, soap, and water. For males, if you are not circumcised, be sure to retract the foreskin to cleanse. Reduce the foreskin when finished cleansing. Triple antibiotic ointment may be applied to the tip of the penis to lessen irritation at the insertion site after cleansing is completed. It's common to have some bruising and swelling of your scrotum and penile area following surgery. It's normal and should go away after the catheter is removed. In order to reduce swelling, place a rolled up towel underneath your scrotum whenever you are sitting or laying down. Another recommended way to reduce swelling is to wear supportive briefs following surgery.
How do I deal with penile irritation? A. Cleanse around the catheter insertion site with rubbing alcohol. B. Cleanse area around the catheter insertion site with soap and water and apply triple antibiotic ointment. C. Cleanse around the catheter insertion site with vinegar and water. D. Cleanse around the catheter insertion site with water and apply baby powder to affected area. The answer is B. Cleanse area around the catheter insertion site with soap and water and apply triple antibiotic ointment.
Bladder spasms are contractions of your bladder. They're very common while a catheter is in place and can often be instigated by a bowel movement. Signs of bladder spasms include pain in the tip of your penis, urinary or bloody discharge around the catheter insertion site, and pain in your lower abdomen or pelvic area. To minimize bladder spasms, avoid constipation and reduce sudden movement that may pull on the catheter. We can also use medication management to decrease spasms. It's common to have leaking around your catheter, especially when you're experiencing bladder spasms. To help manage these symptoms, you can use incontinence products and monitor the draining of your catheter. If the catheter is not draining well, lie down flat and drink a lot of water.
Bladder spasms are very painful. What can I do to help? A. Take a stool softener. B. Reduce sudden movements. C. Take pain medications. D. All of the above. The answer is D. All of the above.
Hematuria is the presence of blood in your urine. It's normal after surgery to have small blood clots in your urine. They will go away with time. Large blood clots, however, can block your catheter and cause urine to leak or your bladder to spasm. If you see any blood in your urine, drink more fluids until your urine clears up. Call your doctor immediately if your urine stops draining completely. You'll be provided with a pocket-sized hematuria scale. The scale will allow you to measure how much blood is in your urine. All hospital and clinic staff will use this scale. They will know exactly how to assist you if you tell them what number the urine in your catheter bag is closest to. It will also assist us in determining the best treatment plan for you.
True or false? There is blood in my urine. This is abnormal. False. Blood in the urine is very normal and should be expected. If you are having dark blood in your urine, it is important to contact your doctor for further instruction.
Pelvic muscle exercises are exercises that strengthen the muscles that control the flow of urine and bowel movements. These exercises are also known as Kegel exercises. They can help keep you from leaking urine, gas, or bowel movements if leaks are a problem for you. Both men and women can learn to do Kegel exercises by stopping and starting the flow of urine. After you learn which muscles to tighten, you can do the exercises in any position, sitting in a chair or lying down. You do not need to do them while you're in the bathroom. Do the exercises at least 6 times a day. Each time, flex your muscles 8 to 12 times and hold them tight for 6 to 8 seconds each time you tighten. Keep up this routine for at least 1 year. You'll probably notice results, but it might take a little time. Kegel exercises can be very helpful to your recovery. They help reduce urine leaks in people who have stress incontinence, which means they leak urine when they cough, laugh, sneeze, or strain. Control sudden urges to urinate that happen to people with urgency incontinence.
I am having urine leaking after the catheter was removed. What could I do to decrease the chance of leaking? A. Do jumping jacks 5 times per day. B. Walk long distances. C. Sit in a chair for long periods of time. D. Do pelvic muscle exercises, also known as Kegel exercises, 6 times per day. The answer is D. Do pelvic muscle exercises, also known as Kegel exercises, 6 times per day.
Being constipated typically means having difficulty with bowel movements or infrequent bowel movements. Almost everyone has some degree of constipation in his or her lifetime. Although it's not usually serious, people often feel better when their system is regular. Some of the most common causes of constipation can include pain medication, recent surgery, limited mobility, dehydration, and a poor fiber diet. Treatment options that are typically used include an increase in water intake, high fiber diet, and stool softeners such as Colace and Miralax. In circumstances that severe constipation occurs, treatments like laxatives or enemas may be necessary and help relieve abdominal pain associated with constipation. If you're not passing any gas, have increased nausea, or your abdomen is distended and you're unable to have a bowel movement, contact your provider for further instructions. Your provider will often prescribe medications to you to help prevent constipation related to recent surgery.
I am having constipation. What can I do to help relieve this? A. Take a stool softener and drink more water. B. Drink more soda. C. Sit on the toilet for lengthy periods of time. D. Take more pain medication. The answer is A. Take a stool softener and drink more water.
Exercise and activity are very important after surgery. You'll be encouraged to get out of the bed and move the same day as your surgery. This is under the direct supervision of nursing staff. Your first time out of bed will be with the assistance of 2 staff members. You're given many medications in surgery that have side effects that can affect your balance. We don't want you to become dizzy and fall. After your post-surgical vital signs are completed, staff will encourage you to dangle your feet over the edge of your bed in a sitting position. They'll give you detailed instructions on standing and moving. This process is slow, with resting points during each step to ensure you're strong enough to move further without the risk of falling. The best thing to prevent blood clots is to get up on your feet again and walk. In order to prevent blood clots in the hospital, you'll be encouraged to move and pump your legs every hour while you're awake. You'll also be encouraged to cough and deep breathe after surgery. This means you need to take a deep breath to fully expand your lungs. This should be completed every hour while you're awake. The deep breaths often cause coughing as the lungs expand. The lung expansion helps to prevent pneumonia and other breathing complications that may occur after surgery. Nursing staff will remind you and encourage you to complete these exercises.
What kind of activity is expectable after surgery? A. Walking around the house. B. Deep breathing. C. Pump your legs and move your feet while you are awake. D. All of the above. The answer is D. All of the above.
Thank you for taking time to watch this video. We hope that it has helped answer questions you may have. In addition to this video, the clinic will provide you with a cancer packet. You will find general cancer information and additional information and support groups in your area. Us Too is a local support group specifically for men with prostate cancer and their support systems, including spouses, partners, and family members. They have typically met once a month on the fourth Tuesday in St. Cloud from 5:30 p.m. to 7:30 p.m. This is a social and educational support group. It allows patients access to more information through guest speakers and informational talks regarding various aspects of prostate cancer, including diagnosis, treatment, and the quality of life issues. The American Cancer Society provides information about your specific type of cancer. They can help you understand your cancer and treatment options, assist with explanation of insurance coverage, and find programs in your area for people with cancer. They have a cancer information specialist available 24 hours a day, 7 days a week, or you can receive information online at www.cancer.org. Reimagine.me is a website support community that gives patient information on coping mechanisms, group support sessions, and access to licensed therapists. Their core program allows patients to work at their own pace through a STEP program. The program consists of 10 self-paced online modules with more than 100 activities, videos, and live sessions for $14.99 a month. Easy, anonymous, and affordable. The core program will help patients, survivors, friends, and family all find support they need at any time in their cancer journey.
The Goretzky Guest House provides temporary lodging in a home-like setting for families and patients receiving medical care in the St. Cloud community. The Goretzky Guest House is conveniently located across the street from the St. Cloud Hospital and offers affordable nightly rates. For availability or additional information, patients can call 320-251-2700, extension 51774. Patients may also find additional information online at CentraCare.com. If you have any additional questions, please contact Adult and Pediatric Urology Clinic at 320-259-1411.